And then evaluate. So you always have to evaluate your outcomes, right? So questions that fall under this category might include, which teaching is priority for the client with a new diagnosis of pernicious anemia? What do you remember about pernicious anemia?
Is that the vitamin B12 deficiency? It's injectable, or you have to inject it?
They're going to need B12 like forever. What do you want to teach them? What if one of the choices is eat lots of fruits and vegetables?
Don't they need some meat?
Well, fruits and vegetables help someone with pernicious anemia. It's fine if they want to, but it's not going to help this condition. That's right. They don't have intrinsic factor. So no matter how much of it they ingest, they're not ever going to absorb it. So what kind of teaching do you do? What do you want to tell them about those injections?
It's very important to stick with it. Make sure you do it.
It's important to follow up on schedule with your provider to get your injections. Do you want to tell them what symptoms are if their level is too low, if they need to come back into the hospital or the clinic or whatever? So some of that teaching about when to come back in and when to seek help might be appropriate. After administering mannitol, which measurement indicates therapeutic effectiveness?
Urine output.
Urine output is an indicator. Is it the best therapeutic indicator?
Would you measure ICP?
It's the decreased intracranial pressure. So it's almost more like the urine output is a side effect. Like, yeah, we're measuring it and it's definitely important, but the real therapeutic outcome we're looking for is decreased intracranial pressure, right? And maybe I don't want to put that in the choices. What kinds of things indicate somebody has decreased intracranial pressure?
They're oriented.
Decreased blood pressure.
Somebody who's oriented, somebody who is either normotensive or has a blood pressure that has trended back down.
Normal urine output.
At least normal urine output. What else?
No headache.
They don't have a headache. So any signs of increased intracranial pressure, if they're reversing, is going to be a sign that the mannitol is being therapeutic. All right, after a chest tube is inserted, which assessment causes the nurse to reevaluate the chest tube site?
No output.
If it has no output,
That continuous, like, bubbling.
Yeah, bubbling.
Okay.
so we're not going to get into the bubbling, but it depends on which device you use, because there is a dry suction and then there's a water seal. And they operate slightly differently. And in both cases, the bubbling is important, but in different ways. So you want to make sure you know your device. What else about a chest tube site might make you reevaluate it?
It's leaking air around it.
How do you know if it's leaking air?
Just looking. You can hear it. You can see the bubbles.
Okay, so if you think you're seeing air, what else? This is a really fun one, y'all.
You're getting
Sub-Q air.
Sub-Q emphysema. So if someone has a right-sided chest tube and suddenly the right side of their face starts to look edematous, touch it for some Rice Krispies. That might make it's all air. It pushes up under the skin. So you want to make sure that you're evaluating for that. If the chest tube site was draining around the site, like the dressing was starting to get saturated, then you're worried that maybe the actual chest tube site's not effective. What do you do if a chest tube comes out?
Put it in saline water.
comes out of the chest.
What if it comes out of the chest?
Three-sided tape dressing on it.
Three-sided dressing, whatever you got on hand, really. Now, a really nitpicky test question will be like, oh, well, it has to be Vaseline gauze. Well, that's great, But are you really going to leave their bedside to go find some Vaseline gauze? So really, whatever you got, like quick. 3 sides. Why 3 sides?
Yeah.
Still didn't have air.
And it'll suck back down against the chest wall to prevent air from going in. And then you can deal with making it a proper dressing and trying to get somebody to reinsert it and all that kind of jazz. And again, this is one of those where you can insert any procedure and any kind of abnormal assessment and make your own question out of it.